Good morning. Thanks to Jay and Vicki, Jay's back, for interpreting this morning. We enjoyed having Sarah, Jay, but, you know, I was looking super tall last week. So this week is like the tale of two cities. On the one hand, we celebrate the arrival of the first vaccines in Hamilton County. On the other hand, we mourn the loss of more individuals from our community, because our numbers are still very elevated. So let's get to the numbers. Positive cases in Hamilton County are at 43,939. The increase from last week is 4,683. Hospitalizations are up to 1,893. The increase from last week is 123. And deaths sit at 394. The increase from last week is 12. And from those of you that are keeping track of those numbers, that number 12 is about double where we were last week. So we've clearly got an upward trend here. Well, I shouldn't say trend, it's an upward number. Trends are a culmination of numbers, and so Greg will speak to that, but that number is a bit troubling. So although we appear to be on a plateau for now with the positive cases and the hospitalizations, the plateau is very high. So we all continue to need to do our part to bring that plateau down and bring those numbers down. So, you know, we need to try to get to zero. 0 cases, 0 hospitalizations, 0 deaths, and 0 closures in our community. And we know what to do: social distancing, masking, hand washing, and limiting our COVID footprint. So on that last piece, so what does that look like during this holiday season? What does it mean to reduce our COVID footprint? So with some basic rules to guide you, everyone can lower their risk and the risk of others and live our lives while we wait for the virus to be widely accessible to the community and get the virus under control while we wait. So we can all work to get to zero by doing something to adhere to the COVID prevention protocols and minimize our footprint, minimize our exposure. So what can we do while we're getting to zero? Our businesses and holiday attractions have shown a lot of innovation in creating experiences our region can enjoy while helping us minimize the exposure to the virus. So today, Greg Kesterman, the Hamilton County Health Commissioner, is with us, as is Jean-Francois, who owns Taste of Belgium. He is going to join us virtually. It's Jean-Francois Flachet. Sorry, Jean-Francois, I didn't finish out your name there. And so he is doing a lot related to his businesses to try to respond to what we all need to do here. And so we'll get to that in a minute. In addition to what he is doing, I reached out to a number of other businesses just to get a sense of what's happening throughout the county and what other business owners are doing, whether it's, you know, retail or restaurant, or what folks are doing to try to be part of the solution here and try to keep people safe. So I want to share just a little bit of what I learned. First of all, local businesses, especially restaurants, are doing carryout and encourage people to do carryout, and are also selling gift cards. Gift cards are so important because that can be a lifeline for so many of these businesses. Immediate income, right? So in Columbia Township, out of 50 West, Bobby Slattery told me that they've done quite a bit, and I don't know if y'all have been out to 50 West, but they've got this huge outdoor area. And so the first thing he always mentions to me is that they saved the jobs of the people that work there because they, you know, adjusted and they were able to keep everybody employed. So they've figured out how to do online ordering. The inside space is closed, and instead they turn their beach volleyball courts into a big sand playground for kids. And they've also put in an ice skating rink, and you can skate on the rink by reservation. It's pretty crowded, evidently, especially on the weekends, but tons of fun, and he's got tons of outdoor space out there, he and his partners, to accommodate people outside. So hats off to 50 West, one of my favorite breweries. In Mount Healthy, we talked to James Wolfe, who's the mayor. He talked a little bit about Fibonacci. It was a fairly new business out in Mount Healthy. It's a winery and a beer establishment, so a brewery. So they have an outside beer garden that's open. They've installed a drive-up window, and they're doing delivery, all new to Fibonacci. Square Mile Coffee, which is also in Mount Healthy, is doing quite a bit of carry-out. And while they didn't, this was interesting, they didn't qualify for the CARES Act funding because they haven't been open yet for a whole year. So the county was able to help with some CDBG funding to try to keep them open during a difficult time. Just Queuing in Walnut Hills is doing carry-out. They're also doing curbside delivery, so you don't even have to get out of your car. You order and they bring it out to you. And in Over the Rhine, Smith Hannon, which is a bookstore, if you order ahead, they will have the book ready for you, so the amount of time you're spending in that space is very limited and very short. So as you can see, throughout the county, folks are doing what they need to do to make adjustments so that we all can be safe as we patronize these businesses. So this is my pitch for small businesses. I used to be a small business owner. Please try to think of a way to support your small businesses in your local communities so that they can make it through this pandemic and we can all stay safe. So Jean-Francois, we'll get to you in 1 second. But I wanted to highlight just a couple of other things that are going on so that, again, people can stay safe while they celebrate the holiday. The Cincinnati Zoo Festival of Lights is accepting reservations to go through so that people are spread out. There are 2 drive-through light celebrations, one at Coney and one at Sharon Woods. The Purple People Bridge is illuminated with 1,000 lights and a huge Christmas tree. This could be a new tradition, and North American Properties has come through with the funding to make that possible. It's called Winter Nights, River Lights. The Cincinnati Park Foundation and the Women's Committee of Cincinnati Parks presents a weekly hiking challenge. So you sign up every Monday, you receive a printable self-guided hike, trail map, and a scavenger hunt in your email inbox. I love that one. The Fountain Square Ice Rink now has bumper cars, which I love. So there's a timed reservation system with a maximum of 80 people to increase spacing, but I think that's a hugely fun idea. So our businesses and attractions are doing everything they can to help minimize our risk and get us to zero. So thank you to everyone that's been creative, innovative to try to help us all stay safe. So with that, I'm going to turn it over to Greg. Greg is ready to talk about the numbers as always and a little bit about the vaccines because we've seen these rolling out in our community. It's very exciting. And so he's going to help us understand that and talk through the timeline a little bit. And then we're going to get to Jean-Francois. Thank you.
Thank you, Commissioner, and good morning, everyone. So over the last 7 days, we've continued to see a slight slowdown in the number of increases that we were having with regards to cases here in Hamilton County. We continue to be at a very high plateau with overall cases. Our hospital systems, our intensive care units are still really full and really over capacity of where they need to be. So we are still urging everyone to do their part to help reduce cases here in Hamilton County. I'd like to start by saying that if you have symptoms or need to get tested, there are many opportunities within Hamilton County. You can visit our website, which is hcph.org, and find all of those locations, including those with the Test and Protect program. Remember that if you're feeling sick and you get tested, it's extremely important to stay home until you have your negative test results. If you're positive, then you would be isolated for 10 days. That's an important tool to preventing us from spreading COVID within our community. Looking at the numbers for Hamilton County, this graph represents our cases over the last, well, since the beginning of the pandemic. As you can see, the cases are elevated at this time, but they are not climbing up that steep mountain that we were seeing in the beginning parts of November. In fact, the last couple days, cases have been a little bit decreased. In general, my team is receiving between 350 and 500 new cases per day. So just a lot of activity. And remember that these cases, some of them, will translate into hospital stays, intensive care unit admissions, and ultimately death. So we really want to lower our footprint within our community. If I could expand upon the numbers that Commissioner Driehaus just shared, Hamilton County, as she said, has 43,939 cases of COVID. Of those, 31,937 individuals are presumed recovered. What that means is it leaves us with 12,000 active cases of COVID within our community. So when you're out and about, if you're not being careful, the chances of getting sick are extremely high right now. So use all of those tools that we've been talking about throughout the pandemic to keep yourself safe. We're asking you to mask, social distance, and hand hygiene. Looking at the hospital numbers for moving on to the reproductive number for Hamilton County, these continue to be tracking just above 1 over the last week. Today we are at 1.08 and 1.04. We want to see this number come below 1 so we can see the overall average number of cases start to decrease for our community, lowering our footprint of how much COVID there is currently. Moving on to hospitalizations, for Hamilton County proper, we continue to see between 7 and 15 hospitalizations over the last couple weeks. They are dropping a little bit for our residents. However, as just mentioned, when you look to the region's hospital systems, we have about 760 patients within our regional hospitals. That number is super high, and unfortunately, a portion of the slight decrease that we've seen in the last couple days is a result of some death. Similarly, when you look at the intensive care units, there are about 175 patients in our region's ICUs. That number is very high as well and continues to be difficult for our medical systems to manage. So really important to continue to work to lower COVID within our community. And I would like to then touch just a little bit on vaccine. We saw yesterday, or 2 days ago in the news, that the University of Cincinnati Medical Center received their first doses of COVID vaccine. They actually received the Pfizer vaccine. They had 975 doses that are going to begin to vaccinate their highest risk workers. So that's great news. These are the first doses to be administered in Hamilton County and the region. We learned that public health will begin to receive some medication, some vaccine, the Moderna vaccine, on December 22nd. We will receive 1,800 doses of Moderna. This vaccine is designated for our EMTs and paramedics within our communities. Remember that these folks are the frontline workers that show up when somebody is sick and are putting themselves at risk and have been doing so since February. So to all of those workers, we say thank you, and my team is excited to help get them vaccinated quickly. We will learn more about how much more vaccine the county will receive in coming days and weeks, and as we do that, our team will begin to work through all of those that have been listed by the federal government and the state as Phase 1A. As we have more vaccine, we'll continue to work through those priorities, and eventually, come early spring, we hope to be able to set up some larger points of dispensing and make vaccine more widely available to the public. With each vaccine, we will slowly begin to slow the pandemic. Even those being vaccinated are asked to wear their masks, social distance, and practice hand hygiene, because these are the tools that we have to help reduce COVID in our community. So in closing, just remember, please always do those items. Wear your mask, social distance, and wash your hands. I sound like a broken record because it's so important. And then as a community, we will be able to come together and eventually end this pandemic. Thank you.
Thanks, Greg. All right, so now we have actually Jean-Francois on the line, and he has a video that shows what he is doing at one of his restaurants. As many of you know, Taste of Belgium has a number of restaurants throughout the county. This one is in the Rookwood location, and I'm going to let him tee that up. But before we do that, I just want to be clear. that, so many businesses have tried to accommodate this idea of outdoor dining. It's not for the 30-person office party where you're getting together with people that are not in your bubble. That's not what we're talking about. We're talking about the people that you interact with on a daily basis, your immediate family, your bubble, and that very, very small group, and what restaurants are trying to do to accommodate outdoor dining for those in those bubbles. I didn't want to be misunderstood. So with that, we're going to go to Jean-Francois. I see you on the screen. Welcome. Good morning.
Good morning. Thank you, Commissioner Driehaus, and thank you for giving me the opportunity to address the county. My name is Jean-François Fléchet. I'm the founder of Tessot Belgium. We're a local restaurant group. COVID has changed many things. We just opened a new full-service restaurant at Kenwood Mall that you see right here in the old Ruby Tuesday space. I would have never thought to open a restaurant under a tent in the middle of winter, but here we are. There's been a lot of misinformation and speculation about COVID and the way it spreads and what behavior are riskier than others. What we know for a fact is that outdoor activities are safer than indoor activities because it involves more fresh air. Therefore, what we try to do is really bring the outdoor indoor by adding outdoor tents with conditioned fresh air at most of our location. We are using blowers to bring conditioned air from the outside into the tents, and we are literally pumping tens of thousands of cubic feet of fresh air per hour into those tents, therefore creating a safer environment. Our industry has been unfairly portrayed. New York City restaurants just shut down again, although Governor Cuomo stated 1.7% of COVID cases traced back to restaurants and 74% traced back to informal gathering. If you look at historical data throughout the country, you will see a spike of cases after Memorial Day, after 4th of July celebration, after Labor Day, after Halloween, after Thanksgiving, and I'm sure we'll see another spike after Christmas. And guess what all those dates have in common? Restaurants are closed. Restaurants have been open in Hamilton County since the end of May. We have followed and enforced all the rules. We have enforced mask wearing long before it became a mandate. We have been the responsible industry all along. This is what we do. We worked with the health department daily, COVID or no COVID. If you come with more than 10 people in any of our restaurants, we will break down the group. We place our tables 6 feet apart and we separate them by physical barriers. If you do not wear a mask, we will ask you to wear one. If you do not comply, we will ask you to leave. None of this is happening in private parties. Restaurants are much safer than informal gatherings, and the data point to that. Nobody in our industry would argue that there is a 0 probability you will catch COVID at a restaurant. However, if you catch it, it will be most likely be from someone you're dining with. And this is the key element. You can support local restaurants by going out safely within your bubble. Just like you shouldn't hang out with 10 friends in someone's basement for Monday Night Football, you shouldn't go to a restaurant with a large number of people from outside your bubble. We can find a middle ground without sacrificing an industry that gives Cincinnati and the county such vibrancy. If everyone waits until the spring to go back out to eat, all the independent restaurants you claim to like so much will be gone. We can save the restaurant industry and do so responsibly. We are all hanging on a thread. Most of us are weeks away from insolvency, and many have already thrown the towel. In conclusion, please take your bubble out to local restaurants. If you're less comfortable, go out on weekday. Restaurants are much quieter and could really use your business. If you're less worried, come see us on a weekend. But please be mindful of our team members. If you interact with them for more than a few seconds, please wear a mask out of respect for them, just like they do out of respect for you. Thank you.
Thank you. Thank you for that important perspective. All right, Bridget, I think we're ready for questions.
Thanks, Commissioner. First up, we have Larry Seward. He has questions for both of you, Commissioner Driehaus and Commissioner Kesterman.
Good morning to you both. My questions are about with the vaccine now. How much demand are you getting from the EMTs? How are they signing up to get the vaccine when it's their turn? And also, how much demand do you anticipate from the public? And do you think we will get to a point where people will need to show that they're vaccinated to take advantage of entertainment such as restaurants?
I'm going to very briefly answer what I know, and then Greg has already gotten up and is ready to answer the rest. So as I've said before, and I hate to call it a hierarchy, but there is a hierarchy as to who gets the vaccine. And once we get past hospital workers and some of those congregate settings where elderly people are, nursing homes perhaps, then as the county gets vaccine, we are pushing it out to EMTs, first responders first in our community. And my understanding, and I haven't been in all those rooms, but they are open to that and they are anxious to get it. So I'm going to turn it over to Greg because he has been in those rooms.
Thank you. So we have in Hamilton County, my agency is responsible for, I believe, 36 fire departments, making sure that they get the necessary vaccine. And every fire department has been very active in interacting with our team and will play a major role. A large number of fighters and EMTs and paramedics will be first to get that vaccine. Remember, the vaccine will go to health patient-facing workers first. So we're really looking at the folks that are helping save lives on the ambulances. The EMTs, the paramedics are first round to get that vaccine, and they're happy to get it, and they're happy to partner with us.
Thank you. Next question from Todd Dykes, WLWT, Channel 5.
Bridget, is it possible to ask a follow-up? I wondered if I could ask John Francois, as a restaurant owner, his thoughts on the vaccine's impact on his ability to expand operations, and would it be something he would consider asking to see vaccination proof?
Thank you. Larry, do you mean vaccination proof for team members, making it mandatory, or vaccination proof for people, for diners to come into the restaurant?
For both.
Vaccination for diners, I think that's quite a stretch, so I'm not exactly sure how that would work. For workers, that's something that we are actually looking into right now from HR policy. Is this something that we can enforce or not? And in terms of the impact on the industry, I think that the vaccine is really going to take a while before it really has an impact. So on our industry, the key is really to keep on enforcing the rules, and then hopefully we can get more outdoor dining as the spring comes around, but it's going to take a minute.
Thank you, Larry. Is that does that end your questions?
It does. Thank you.
Thanks. Next up, we have Todd Dykes with WLWT. Todd, who would you like to ask your question to?
Greg, since you're at the podium, a question for you. I know I'd reached out a week ago or so when HHS released that massive amount of data regarding area hospitals and bed counts and et cetera. And the direction was more to go to the Health Collaborative. I'm wondering if you've had a chance, if anybody on your team has had a chance to kind of look at that, because you mentioned the ICU beds, you mentioned the regional beds for the data that you're looking at. That, for the public that wants to go look at that HHS data, do you have any more? I didn't have a lot of faith in it last week because it seemed so spotty. Do you have any sense of where things stand on that front today? Because HHS said, look, the data isn't perfect. Please help us. But how important is that, do you think? And where do you come down on that?
So I do think the more data that you have available and from a public perspective is ideal. Many of the slides that I review on a daily basis, we actually publish on our website, and that includes the graphs that you saw today, including those graphs from the Health Collaborative. The Hospital Association of Ohio also now has started updating on their website details about how much hospitalization and intensive care unit admissions there are in the state of Ohio, and I believe you can look at regions from their website, so another great resource. And then lastly, I believe in follow-up to the conversation that was had 2 weeks ago with Dr. Lofgren, I believe the Health Collaborative is leading a charge to create a more user-friendly dashboard, and I'm not sure of the status. Unfortunately, that would be a question for them.
Thank you.
Next up, we have Courtney Francisco from WCPO, and she has questions for Greg.
Hey, Greg. Okay, so nursing home policy and procedure. Have you considered sending sick patients to the hospital to isolate them in an effort to bring the number of deaths down in congregate care settings?
No, so our nursing homes, they manage their patients and they keep their patients there if they're able to manage their care appropriately. Nursing homes have very strict policies on infection control, and so there's processes in place depending on the type of nursing home where if they have a couple cases of COVID, they isolate those patients to a certain area of the nursing home and actually only have staff work with those patients and not switch between groups so that they're not likely to spread COVID-19.
But is that not working as much there as it is in actual hospitals, or am I not understanding what's going on there?
No, so nursing homes are definitely a hard-hit community with regards to COVID-19 because they are serving elderly individuals, often with other health conditions, and COVID has just been very hard for that older demographic. So nursing homes have done a fantastic job. They do represent a high portion of the fatalities that we've seen associated with COVID-19. When a patient is unable to have their basic care met within that nursing home, they would transfer them to the hospital. Oftentimes, individuals that are getting released from the hospital do have to be tested before they're allowed back to the nursing home so that that nursing home knows their COVID status and is able to safely keep positive cases separated.
Thank you.
Next up, we have Ann Sanker with the Inquirer for questions for Commissioner Kesterman.
Good morning, Ann.
Good morning. Thank you very much. Nice to see you all. Greg, I wonder if you could talk a little bit about, go back and talk about the numbers and I wasn't quite clear when you were talking about the decrease in the hospitalizations was due perhaps more to deaths than to discharges. Did I understand you properly? I wonder if you could revisit that, please.
So when you look at our regional hospital systems, we know that those numbers are not continuing to climb at the exponential rate, which is great news and a sign that there's at least a little bit of hope. That said, we've been at this 750, 700 mark now for a few weeks, and we've been hearing from our hospital partners that that number is really hard to manage. In addition, when you look at our regional deaths, we're seeing about 15 deaths per day on average in the region. While that's not making up the entire portion of those not hospitalized, it's a real number, and it reflects that people who end up in the hospital, end up in the ICU, often they don't all make it out. Some portion of those individuals are not surviving. And so that's what I was referencing.
Okay. All right. And then a quick follow-up with Jean-Francois. Should restaurant workers be considered frontline when the CDC starts deciding who among the essential workforce gets vaccines? Where do you think restaurant workers fall?
Well, the restaurant industry had been considered an essential industry since the beginning of the crisis. So I think that the logical step is to say that anybody who works in a restaurant should be considered an essential worker. And so I know that with the Ohio Restaurant Association, we are pushing to get vaccination ahead of the general public because of the exposure from that our team members have.
Thank you very much.
And add on, so the stratification for the tiers comes from the federal government. Then each state has an opportunity to refine that and send it down. That has not happened yet for the other phases, although preliminarily the federal government has listed essential workers as phase 2. And my understanding is that includes grocery workers, restaurant workers, and others that are necessary to ensure that the population can stay fed and healthy.
Right, but the fight at the moment right now is how does that stack work? Once they make the decision, how do you define categories of essential workers? Because not all of them can get the vaccine all at once. So that's my question: is where do the food workers come in on all of that?
So we're looking at a four-phase approach. We're in phase 1A. When we get to phase 2, there will be some stratification that comes from the federal government first and then to the state. So we would look to the state leadership to determine who gets it and when in phase 2.
Okay. Thank you very much.
Thank you. Next up, Christopher Wederick from the Business Courier has questions for Jean-Francois.
Hi, Jean-Francois. Just a question about you showed a video kind of showing how air gets in and out of the tents. Can you talk a little bit about why is it really safer to be in a tent like what you showed being in your restaurant? Is the air filtration any better?
The one thing with the tent is I think the key is really the massive amount of air that we are pushing in through the blower. So the air is coming straight from outside. We're pushing directly outside air. I mean, which is the same than with the restaurant, but with the restaurants you don't have the windows open. With the tent, as you push the air, it gets forced out through underneath the tent because the tent is not sealed. So there is more airflow in the tent than you would have inside a restaurant. And the key is to have those blowers. So if you were to just put propane heaters inside the tent, that would be very different. So the key is the air blowers.
Thank you. We have a follow-up question from Todd Dykes, and it is for Commissioner Kesterman.
Yeah, and Jean-Francois, I'm sorry, I don't mean to upset the apple cart here, but that's interesting because you see a lot, and we've all seen them, the Facebook memes, but it's like, oh, I can eat outside, inside, and you just, I don't know. But would you advise people that want to go out to eat to really kind of look for blowers that are doing that air movement? Because I assume there are some restaurants that aren't that sophisticated. What do you think about that?
Well, the thing is that some other restaurants may have the sides crack open, so there are ways of getting fresh airflow out. You're going to get more airflow in a tent than you're going to get inside simply because you cannot seal the tent. And then that's really up to people in terms of the level of comfort. At the end of the day, a lot of it is perception.
Okay, appreciate that. And Greg, really quickly to you, the news yesterday, it seemed to be a headline about the new at-home COVID test. I'm sure you saw that like everybody else, or maybe you were privy a bit earlier, I don't know, but would you advise people how to use those? It's available for like $30 and you don't have to have a health professional help you with it. What's your sense of that?
I think people need to assess and work with their medical provider to determine what test is best for them. I think the more opportunities we have for testing, the better off we as a community are at quickly isolating individuals that are sick. By far, the PCR test that you have done at a medical provider is kind of like the gold standard, and it's the most accurate, and actually now it's often able to be read within a day or two. So first, I would always encourage someone to go that route, but if you're not comfortable, consult with your physician and consider the other options.
Thank you.
Another question for Jean-Francois from Corey Sharber with WVXU.
Thanks for taking over our questions today, John. Of course, I'm not going against like any of the guidelines you're putting into your restaurants. It seems like you're doing a good job of keeping people distant and bringing the air from the outside in. Federal agencies have really only given recommendations for restaurant owners and operators to keep restaurants safe. But why haven't they explicitly said that indoor dining and outdoor dining and things like that are okay?
I don't know, why hasn't the CDC updated their guidelines to say that exposure is different if you wear a mask or you don't wear a mask? I think the federal government has been such a mess that I don't know how much credibility we can really give to their response. I'd rather look at what we do at the state and local level, because I think it's been clearer. Sorry. We try to follow all the guidelines and also follow common sense. So, for example, I'm pretty sure at the federal level, no, actually, that's at the state level. You can have an exemption if you are walking over a fryer or a hot surface that you do not need to wear a mask. But then the problem is that one day, months ago, I walked into one of my restaurants and nobody was wearing a mask in the kitchen because everybody said I'm on fry today. So from that day on, we enforce and we put everybody as a mask at all time, and we've seen no contagion inside the restaurants. So there are the rules, and then there are the common sense, and I think a lot of it really has to do with common sense.
Okay. Thank you very much.
perspective as well. I've been saying a long time throughout this pandemic that we really need to support businesses that are doing things correctly. And I have personally, and my team has personally walked into businesses that are not, and we work with those businesses to teach them how to do things correctly. And so each of us needs to make that personal decision and funnel our time and our efforts towards those businesses doing things right. And we also have to make personal decisions about risk, and we all are doing so on a daily basis. So my family, I do not eat out at restaurants, but I routinely get carry out from restaurants because that works best for my family, for my schedule, and I believe that's safe and I'm comfortable with that level of risk. Some families feel like it's time to move into those outdoor spaces because they need, for their own mental health and for their own safety, or for their own mental health and their own well-being, they're choosing to eat in restaurants. When you do that, I think it's possible to do so safely, but you as a family have to continue, as we'd heard, to stay within your bubble, and that includes your family and your friends that you're always around, not 10 friends like the football scenario in the basement that you get together with once every Sunday. So we need to look at each of these environments and consider if our family is okay with it. And I would really encourage, if you're not comfortable in that environment, to continue to support these small businesses and restaurants with gift cards like Commissioner Driehaus shared, or through carryout, because these are ways that you can continue to show support, enjoy fine dining, and keep our businesses open and healthy and families employed.
Thank you. That seems to conclude our questions from reporters.
All right, well, thank you to Jean-Francois, thank you to Greg, as always, and our interpreters. We are going to be here next week on Wednesday. We're bumping up against the holiday, but we felt that it was important to continue to do the briefings, even during the holiday season, to make sure people are well informed. So one other thing, thinking about moving into the holiday, just like Thanksgiving, we are encouraging everyone as a family to make a plan. Don't get stuck in a situation where you haven't thought through the safest way to celebrate the holiday with your family, and you do something that you shouldn't do to put others at risk and yourself at risk. And so please make the plan. I know it's gotten colder. We've set up my mom's garage. There's one big open space where the garage door is. There are very few chairs in that garage. We put up a tree for my mom, and we're all masked when we go see her. We're doing what we can to try to make sure, especially she is safe, because she's in an at-risk category. But don't be caught off guard here moving into next week. So please make a plan. Please do it safely. Please reference the guidelines that Greg spoke about. And please, I've got some new swag today. This is from Public Health, actually, and it says, I don't know if you can see it, it says I care on it, and I think that's part of the message also moving into the holidays. We can all do what we can to keep our loved ones safe by doing things in a smart way moving into the holidays. So thanks everybody for joining, and we will be back on Wednesday.